You need to stop doing rice to recover your injuries.
Movement is going to be the fastest way you're going to recover 100%.
If you experience some knee pain, hip pain, or back pain when you're running,
You might just have weak glutes. If those glutes are weak, you can always go for a bridge test.
Flat on the floor with my back, while my knees bent, and I want to load my heels into the floor to bring both of my hips up. From here, what we're going to do to test is we're going to bring one leg up, and we're going to make sure the hip doesn't sink, because if the hip sinks, the glute isn't activating.
If you fail the glute test, you have these 3 exercises you can work on.
The first one being that glute bridge, so we drive our hips up, but then we practice coming down with one leg.
Second thing you could do is side steps with a resistance band at your ankle.
Doing mini steps, going from one side with a slight bend to your knees. You want to fire to the other side as well.
Last thing you could do is practice different hip hinge movements. One is an RDL, so I always like to have a nice flat wall that gives me feedback to where my hip's supposed to go. And what I like to do is kind of see if I'm directly to the wall, one step forward, so that when I drive my hips back, I have the wall to feedback to say where my hip needs to be. And I have a little bit of a weight, and I focus on driving my hip back. This is going to work on those hamstrings, but also at the top squeezing, you're going to hit those glutes. And 2 is having a normal squat. So front view is with the weight in between the legs, lift your chest up, load your heels to come up, squeeze the butt at the top and come down. But let me know in the comments if this helps you with your knee pain, hip pain, or lower back pain. And as always, follow for more tips on fitness.